Today we're talking plastic surgery. There are over 9.5 billion views and posts for hashtag plastic surgery on social media. Young women, especially young Latinas, are at risk of falling prey to a false reality. We're living in a world where man-made beauty and social media filters set the trend for what everyone should aspire to look like. Filters that you can see what you look different. All of a sudden you see yourself with this filter and you go, I like this look, or I want to look like
emulating?
this.
The filters have big lips, cat
Not all
eyes,
of them.
a lot of them.
A plastic surgeon, Dr. Rady Rahban, sees cases like Nicole's all the time and believes that we have hit a crisis level when it comes to women chasing a false sense of beauty. This is your job. This is what you do.
The truth of the matter is I love what I do. The overwhelming majority of the plastic surgery interactions that I have are profound, life-changing, life-improving, but everything has a flip side. And unfortunately, I do think that we've gotten too far.
What do you consider too far? Like, tell me some examples of what you see.
So I see it every day. When I started, I saw predominantly new patients, people that came in to get things done. Now, a third of the patients I see are revisions from all over the world.
From other surgeries.
Right. So they went in and get something done. They went with great aspiration. You have been incredibly fortunate, but we know that not to be the case statistically. And it really only takes one really bad thing to throw you into tailspin.
Okay, what do you tell them?
Well, I try to get to them before the revision. But once they become a revision, it's really a crapshoot. Sometimes I can help.
Sometimes you can't.
Sometimes I can't.
Where is that line between this is taking over a mental component or internal component of insecurity and, oh, I really do have this thing that is impeding me in my life and it'll make me feel better?
It's such a complicated issue. The cutoff is when that person is seeking something other than the fulfillment of betterment for themselves.
Yeah, but how common is this type of obsession?
It's very common, and the obsession is of varying degrees. Before it was, I'm 60, I like the way I look, I just don't like these bands, so I'm gonna reverse my face.
Right.
Versus I don't like anything about the way I look, and I'm gonna look different. The crisis is now my 16-year-old niece has 1 million images a second of individuals. Images of things that you wanna look like that are not even images of real people. You want your 12th rib removed.
Well, that's what I'm saying.
And your
Isn't
waist this wide.
unattainable.
It's unattainable-ish. Naturally forgettable.
That's what I'm
saying. There's no squats, there's no diet, there's no yoga. I heard
Right.
there's just nothing. So the crisis is a borscht of all these problems. It's young people, the phone, the images, the apps, the fact that there are a lot of people doing these surgeries that are not plastic surgeons. Like let's imagine.
An esthetician.
So you assume that if you go see a guy or gal who does cosmetic surgery, they're trained in cosmetic surgery, right? No, that's not true. In America, I can deliver a baby tomorrow. I can remove a tumor out of someone's brain. I'm not a neurosurgeon or an OB, but I have a medical degree. And in my medical degree allows me the scope of ability to do. The place that will stop me from doing that is the hospital because they require privileges and for you to show that you've done. But 99% of these procedures are done in your own private center.
Oh my God.
I have a lot of Latino patients, maybe a third of my patients. There's a cultural component.
Why do you think that is that it's such a common occurrence with Latinas? It's more popular in Latin America to have the big butt first, or like...
Number one, the idea of being attractive is a much higher of importance. I mean, go look at a telenovela. Go look at a news anchor. There's no other place on TV today where everyone is super hot. The second is that there's a lot of reverence for medical culture. El doctor, él me dijo, that's what he told me. And the last thing is, you said it best, it's a luxury.
Mm-hmm. Yeah.
But in this instance, if you can't afford a good doctor,
It's your life.
and you want it, and I gotta have it, I'll find it.
Well, so that's what it feels difficult. If most kids are seeing all these influx of images, most of those images are things that you need this luxury to attain, then of course they're gonna go get $20 fillers. How do we fix it?
Well, you start by this conversation. You start by people who actually have a dialogue. It's really ultimately our responsibility, right? Ultimately, you can do whatever you want to do, but unless I don't do it,
Yes.
you can't have it. It's interesting because in the same person, you have a person who loves plastic surgery, her nose, because it was something that benefited her and it empowered her. And she has things that she did she hated. Her nose job didn't make her a great, YouTuber.
Right.
But the fact that it was something she wanted that
Bothered her for
enhanced
years.
her, it
Gave her
allowed her
confidence.
to give her the confidence to be the person she's always been.
Exactly.
So it's not going to make or break you. It just pushes you in the direction you're destined to go.
Ultimately, it's about what is right for you. And if a little nip or tuck will boost your confidence or empower you in any way, why not? But just please make sure you consult a board-certified surgeon before having any work done.
I've done so much to myself that probably around your age, I'm gonna need more. Because I
Just
started
fine.
so
But you
early.
shouldn't do that fourth one. You're going to regret it. I
am,
promise
right?
you. Even if you gain weight, you're not going to gain weight in the areas that have no fat because the fat's gone. You're going to gain it in whatever's left.
Yeah, that's what I mean.
You're going to regret it.
I know.